Hi everyone, you're welcome back to my channel. My name is Becky Setra. I hope you're doing well. I know it's been a long time since I've done a video just because I was doing a course and it was becoming too much anyway. If this is the first time you've come across my channel, you're very welcome. Please remember to like, subscribe and share. So as you know, I am a UK registered nurse originally from Ghana, and I just give tips and advice about anything nursing in the UK. So in today's topic, we are going to be talking about people who are considering becoming full-time agency nurses in the UK. So this is a question someone has asked me whether in 2025 it's a good idea to become a full-time agency nurse. So if you want to know more about that, why not watch the video to the end? You're welcome back to the main video. So basically, agency nursing, someone would want to know what is agency nursing. So it's more or less like you are your own boss, you register with an agency and they tell you shifts that are available and you book the shift and then you go and work. And so the advantages of working as an agency nurse in the UK is the fact that you choose where you want to work and you choose when you want to work. You would have that work life balance as well, because if you want to go on leave, you don't have to ask your manager for leave. So you decide not to work when you don't want to work. And also, you are not going to be part of the workplace politics and bullying, which some people are going through, which I might be talking about at some point. Um, you're not going to be going through a lot of those. You can decide to go back to a workplace if you've been there and you feel that you haven't been treated well or staff were a bit mean to you. You can decide that next time you're not going to be working there. You can choose your work pattern. Either you want to do nights only or you want to do day shifts only. You can do that. And in addition to that, especially for those who have children and would want to have that balance where they can choose when they want to work, that's a good idea to do agency. um, and actually the good bit is that agency nurses do earn more money, but I'm going to be talking about the disadvantages in a bit. So they earn more money. Some time ago, agency nurses, some were earning about 4,000 or 5,000 a month. But bear in mind, pensions and all that, you have to sort out your own pension. So those are some of the things I'm going to be talking about in the disadvantages. So let's go straight to what the disadvantages of working as an agency nurse in the UK. I think in US they are referred to as, I guess, that is travel nursing. UK, we call them agency nursing. Anyway, so disadvantages are that you have to sort out your taxes. And if you don't, and you don't do it properly, HMRC would be on your case, because I've heard of stories where people have done agencies years ago, a year or two or three ago. Recently, HMRC has been sending them letters with tax bill of thousands of pounds. So if you're doing an agency, make sure your taxes are you're on top of them. Anyway, another one is you have to be traveling to different places. And once again, you may work with certain staff that do not like agency nurses because they feel agency nurses and more than they do. Also, if you are unwell and you are not able to go to work, it means you're not going to be earning any money. So, those are some of the problems with working as an agency nurse. You have to sort out some insurances as well if you want to. Anyway, so currently in 2025, if you are thinking or considering becoming a full time agency nurse, which means you want to resign from your current job and become an agency nurse, you have to be very careful and you need to consider a couple of things I'm going to be talking about. If you are an overseas nurse and you are on a visa, COS, and all that, you cannot resign to become an agency nurse unless, of course, the agency is going to be providing you your COS if it expires. But if you've got your indefinite leave to remain, why not? You can do agency nursing full time. But you need to consider a few things if you are going to be going to do agency nursing full time. The first thing is the fact that agencies do have dry seasons. The dry season I talk about is the fact that there are certain times of the year where there are no shifts. So people struggle to find shifts. So if you're dependent on only agency, it might get to a point where you don't even have money to pay for your bills, because the more you earn, the more your expenditure grows. You buy big cars, you buy big houses, and then it becomes a problem paying for your normal bill. So you need to consider things like that. Also, hospitals are currently cutting down on the use of agencies. Most hospitals are using their own bank staff or bank nurses, and it's cheaper. Someone told me these days, previously agencies do pay about 30, 40, 50 pounds an hour. Now, some are even struggling to get agencies that pay 19 or 20 pounds, and they can't even find it. So the banks, normally the hospitals do pay slightly less than an agency would pay their staff. Even with bank jobs currently, some people who are on the bank are struggling to get bank jobs in their own hospitals, just because, yes, trusts are cutting down on finances. We are getting to the end of the financial year. Secondly, yes, there has been a big recruitment drive, and a lot of posts have been filled, although there's still shortages. And some staff are actually booking the shifts on the award. So there is not a lot of bank shifts as well. So before going full time, it is best to actually consider either keeping a part-time job, reducing your hours so that you've got a job going, just in case you haven't got agency shift. At least you know that you've got a place to go. And even if it's 2 days in a week you're working, you still have something to be able to pay your bills. So I think what you have to do first would be possibly go part time, test the waters, and see how things are. And if you feel you're going to be getting the shifts and all that, why not go for it? But other than that, just be careful. Um, do your own research before you jump into becoming a full time agency nurse. I hope this video has been helpful. Take care of yourselves. If you haven't yet subscribed to my channel, please remember to like, subscribe, and share. Take care, and I'll see you soon. Bye bye.